All right, I have 5216, Mr. James. He's a 72-year-old male patient of I have Dr. Carter. But is it Dr. Punjab?
Yeah, I took over for him.
Okay.
So he went yesterday over to the University Hospital for his stent for his new diagnosis of gastric carcinoma. He apparently doesn't know. He's not aware of the diagnosis, of which I wasn't informed of initially. So I guess his family was waiting for another son to arrive before they told him today.
And who's going to be there with them for this conversation?
We will, and
Yeah, I'll be there.
So he tolerated the procedure fine. He was going to get transfused 2 units last night for his low hemoglobin. But after the first unit, his temp spiked to 1016. It's not clear if this could have been a transfusion reaction. He's also very tacky. He seemed tacky today. You know, he's going to have to be here another couple days until we figure out the source of the fever. We have cultures pending. We can get the RUA and the urine culture, and the chest x-ray so far looks okay.
And his H&H looks good.
Yeah, it looks like he responded 8-9 to 10-7.
A couple of days, you said?
I think so.
has PT seen him yet?
We saw him before his heart rate went up. He would really benefit from SNF rehab, but if the family wants him home, then we'll have to get a home safety evaluation. We can send home health out there in the
Oh,
next...
that should probably wait until after we talk to the family about the diagnosis.
The other thing is his diet. So I spoke with GI this morning, and they said that they could advance his diet slowly. Right now, I think he's on a clear liquid diet.
No, he got the puree.
Okay, yeah, then, so if he tolerates that fine today, then tonight we can move him to a low residue diet. We just gotta make sure we don't give him any fresh vegetables or fruits that could clog the stent.
He wasn't really interested in breakfast this morning, but he had the probiotic yogurt. Do you want him to get that then if he's on the low residue? Is it okay with the bacteria in it, with the low residue
I
diet?
think it should be okay.
He had the yogurt, and then he wasn't really interested in much more breakfast. He just ordered an oatmeal or something. Is that okay?
No, cancel that, please.
Okay.
His meds should start being transitioned to PO, especially his pain meds.
Yes.
He was on IV morphine. I don't know how much was needed.
He just told me he was having some pain, like cramping around the area, like the lower abdomen. He's having a hard time, so I'll give him some oral pain meds and see how he responds to that.
Yeah.
But I won't give him the morphine, the IV then.
Right, we prefer it if he starts taking oral meds.
Okay. And then the night nurse put him on the monitor. Do you still want that?
You know, I would like for him to be monitored still. It looks like he's tacky, like in the low teens.
120.
Okay, yeah, so we just need a monitor for that, if you could jot that down.
Okay, is he on a beta blocker? Has he started?
No, he's not on a beta blocker right now. Should he be?
No, but he was in Mexico, so he stopped taking his medication for 2 weeks. The tachycardia could be reflex.
Well, his blood pressures have been better since he got the transfusion. It looks like low hundreds to 120.
When we round upstairs, we'll talk about that.
Okay, yep.